Hey, man. Hey, how are you?
Well, thanks for having us here.
Well, thank you for coming. I'm really glad you're getting a chance to see the work in action as we are in process to build this new observation unit for the hospital.
Well, I know people are concerned, frankly, around our entire nation about emergency rooms and how crowded they are and some of the challenges. What are you hearing, and how do you think this observation unit might impact that?
So that's a really great point. This is not just a Howard County issue. This is a Maryland issue, first and foremost. It is an issue across the state. It's an issue across the country. And so when we look at our emergency rooms, there's a number of reasons why a lot of people are coming, and it's harder and harder for people to efficiently get through, which is a goal of ours. There's less and less resources outside hospitals, less primary care doctors, less behavioral health, all the things and resources that are non-medical as well. Aging population. So people need the emergency department. And then when they're in the hospital, it gets very tight. This hospital in particular is about 95% full all the time. And so that being full means people can't progress who need to come into the hospital. And that then backs up the emergency department. So that's a very big issue. And that is the biggest thing that we're going to be addressing with the addition of these observation beds.
Wow, that's exciting.
So I was just going to show you here an example of one of the rooms. So one of the nice things is we will have up to 29 physical rooms, and anyone who's been to the hospital knows what our inpatient units look like. This is going to be very similar to that. These are going to be private rooms for every patient. So the ability to have the space for them to be taken care of when they need to be in the hospital. Observation patients are short stay patients, which means like about a 24 to 26 hour stay usually. It's not for someone who needs the more intensive therapy, but there's a lot of people who get admitted that need that kind of care. So that's why an observation unit is very important.
Wow, that's good to know. Now, when's the last time the hospital has expanded its number of beds?
So one of the important things to understand is this hospital is about 250 to 260 beds in terms of size. Now, as you know, the stats for Howard County better than I do, but 2009 was the last time this hospital had an addition. And so everything that's upstairs from here, this pavilion building, that was the new thing that people have added. And so for us, this is the first time that we're adding additional capacity. We've done replacements before, we've done renovations, but to have additional beds for us to be able to take care of patients, this would be the first time since then.
My goodness.
But the county's grown probably by about 18 to 20% in that time frame. And so we're really playing a little bit of catch up to right size over time the hospital for the community.
So tell us a little bit more about the process to get from recognizing the importance of this expansion to where we are now with so much work and showing progress.
So, you know, this has been years in the works, right? And we've been partnering with you and your team now for, ever since COVID really is what I remember, since you were in office and I came into this position. We've been looking at all the different ways that we could help the emergency department. So the first thing that we worked on together was to be able to create that behavioral health unit for the emergency department. Big expansion for us to not only have a good space for our behavioral health patients, but then we retrofitted the space that they were in with upright treatment areas. So 9 treatment bays in the emergency department. And we reduced the waiting time for our patients that go home by about an hour for their total length of stay in the department, which makes a difference. And so that was the first step. And the next step was then to address all the patients that are waiting for beds. Because we have an issue with not enough beds for people who need them, we have what we call patients that are boarders. They're boarding and waiting to go upstairs. Now that number has increased after COVID. We have a 36-bed emergency department, but on average we have about 30 patients boarding, waiting for a bed upstairs. And so that then gluts the entire emergency department. So again, this will be addressing that major issue, all those medical boarders. And so will it take care of all of them on day one? Absolutely not. But it's going to make a very big dent in that, and that is the hope, is that we have the spaces in the hospital to do the treatments that we need for our patients.
My goodness. Well, we see so much work progressing now. What are we thinking? What's next? What's the timeline?
So the timeline for this, as you can see, we have a lot of drywall up. This has been, we did the groundbreaking last fall. So our anticipation for going live would be sometime in December at the end of this calendar year of 2026. That would be the goal, to get that going. And we're working on staffing right now to try to get people to be here for that time. We can't just make them appear on day one. So there's a lot of training and there's a lot of work that's going in behind the scenes to be able to get this unit live. So there's a lot that goes into that. It's not simply just opening the rooms and they'll all move in. A lot of training, equipment, making sure that we have the right staff in place. So that's the time frame.
Well, thank you so much for your partnership,
Well,
and this is such a fantastic
likewise.
program.
I really appreciate your forward thinking and thinking about us as the only hospital in Howard County and the need for our community to be able to get the accessible care that we want them to have. And I'm really just glad that you and the County Council were able to help us out with this. So thank you so much.
Well, thank you.
Appreciate it.
Appreciate you.